Yeah, we converted. This is actually social consumption establishment licensed called The Coffee Joint. It was the first social consumption establishment in the world because even in Amsterdam, they're not licensed. Especially after COVID, they're not much into social gathering. So this little room we converted to a studio for YouTube.
Content presented in Cheshire Corners is for educational and informational purposes only. Please consult a legal professional if you have any questions or concerns about the content of this disclaimer, this series, or the legal implications surrounding psychedelic substances in your jurisdiction.
Hello, welcome to Cheshire Corners. My name is Rita Tsalyuk, and I will be your host as we trip through the looking glass. Today, we welcome our special guest, Gerard Artesona. Gerard is very special in psychedelic area, not just because he lives in California, and not because he brings those epigenetics from Catalonia in Spain, but because he is actually a mental health professional, licensed mental health professional who believes in psychedelic treatment and believes in a whole person's healing. And that's why I would like to ask him a whole bunch of questions and welcome. Gerard, if you want to tell us a little bit about yourself and your story.
Thank you. Well, I also want to just begin by honoring my epigenetics from Cuba and Puerto Rico, as those are the places where my ancestors most recently hailed from prior to coming to the United States. But yes, I am a licensed marriage and family therapist here in the state of California. I currently live in Oakland. I love it here very much. Been here about 10 years. And I can say that I've had a passion for psychedelics and psychedelic healing probably spanning back almost 20 years. I kind of had a one-off experience when I was much younger that I found to be incredibly transformative. And it kind of gave me this idea of something like, oh, well, this could probably be really good if a therapist did this with their patient. And then that kind of prompted me to do much more research. And then I realized, oh, okay, well, this kind of was a thing. That was back in the early 2000s. And eventually I traveled all the way to California and I went to the Institute of Transpersonal Psychology, which ceased to exist. It's currently the Sofia University. And from there, what had really intrigued me was the traditional ancestral use of psychedelics, because I felt that there was something there that likely could be of great benefit if applied in a modern context. And so that brought me down the road that I've been on for about the last 15 years of working with yahe. Some people know that as ayahuasca. And so many of those perspectives, in addition to professional training from the Ketamine Training Center and CIS, along with numerous professional experiences, have kind of helped me to form a way of looking at this in a perspective that is informed by both traditional narratives as well as modern narratives in psychology.
It's very cool. So you studied in transcendent therapy university? How?
Transpersonal psychology.
Transpersonal psychology. Tell me what it is. Tell our viewers, what is transpersonal psychology?
Certainly. Well, surprisingly, I'm somewhat taken aback by the fact that it's not a more commonly known thing, given the current state of public interest in psychedelics. But basically, the gist of transpersonal psychology is that a person with that orientation takes into consideration altered states of consciousness and other kinds of experiences beyond the normal human experience, hence the name transpersonal. We take those experiences as parts that as things that are essential to human health and well-being and things that have value. And ultimately, we understand that those are parts of the human experience just as much as learning to walk or swim or things like that.
So when you're saying other experiences, What kind of experience? Are you talking only about psychedelics or something else more than that?
Well, no, I mean, psychedelics happen to just be like one route. But yeah, experiences of the mystic, experiences of the transcendent, and also that can include dreams, psychic phenomena, intuitions, things of that nature.
Yeah, dreams, that's probably similar to ayahuasca, because DMT during night is the highest at one of the highest level. If you not considering birth and death, then night definitely higher level of DMT. That's somewhat psychedelic experience when you were dreaming.
Well, I mean, definitely in my case, my interest in dreams definitely preceded an interest in psychedelics and preceded an interest in therapy. So it's somewhat of a passion of mine that I've spent a number of years just learning more about lucid dreaming and whatnot.
So tell me, what do you know about dreams?
Well, they've been called the royal road to the unconscious, and that they can. There's dreams that can be kind of like precognitive or intuitive in nature, and there's ones that might just be sort of like say a little bit of sort of like just your mind chewing over things as you're sleeping. But then there's ones that often like will give you very clear clues, or maybe not so clear, but they'll give you clues to things that are going on in your life, like maybe arguments that you haven't processed or feelings that you're not aware of.
I had a dream today. At 3 a.m, I woke up and I saw myself putting one of the spreadsheets that I'm usually working with into ChatGPT and asking ChatGPT to analyze it. And I woke up with such a clear understanding what I need to do with it. It was so cool. And I noticed that a lot of times when people asking me to solve some serious task, I'm telling them, I'm not going to tell you anything today. I have to sleep on it. It has to be tomorrow. And the next day you have such a clear picture. Even you can't remember you dreaming, you still have a clear picture. I don't know. Interesting. I'm always was, in regards to dreams, I always was fascinated with Bible story of Joseph. And that Pharaoh that came and with a dream of cows, skinny cows and fat cows. So I was always fascinated about it.
Oh, I think I'm going to have to look that one up. I haven't been in church in a long time.
Oh, that's my favorite Bible story. There's a lot of kids cartoons about it because I just think it's such a cool story. They take in all the adult content out of it, and for kids it just sounds very cool. So dreams are a big part of our unconsciousness and big part of us. Psychedelics were not a big part of us for a long time, except for few who tried them still and still remember them. But I think in Europe and European culture kind of killed all references to psychedelics slowly when they killed those witches, and later when they fought them in 60s and any time in between. So when they finally were pretty close to be killed, they rised again to a whole renaissance. And now we here in Colorado, and we regulated, and psychedelic almost a part of our daily life. Soon, like maybe a few months. It's just hard to imagine, right? Yeah,
I think we're getting there. But yeah, I mean, I think that kind of speaks to you can almost say like a certain period of history that we're all sort of emerging from right now, and we're in this particular iteration of human history where we have a lot of advanced science and technology, certain kinds of social structures, economic structures in place, and kind of figuring out okay, well, how is this medicine and this branch of consciousness or these medicines and the consciousness they open, how is it going to fit into the modern place? How is it going to fit into the modern world? Given that, a lot of my background is with traditional use of psychedelics, one thing that I look at is cosmology. And so cosmology are a lot of the stories, narratives within certain cultures that kind of explain like how the world works, explains, what's happening beyond this world, give understandings of spirituality and ultimately understandings of the human themselves. And so one thing I think about when bringing psychedelics into a modern Western context is that we don't really have a cosmology, that we're kind of like, as I say, we're like orphans in the psychedelic landscape. And so we're trying to figure out how to get there, how to realize something with this, while also being stuck in a lot of the same tools and a lot of the same ways of thinking that have kind of got the world into this particular state that it's in right now.
Yeah, I remember there was a guest here who was doing psychedelic hypnosis. And then I've read some other information about this, and there is a theory that we got hypnotized since birth by our parents, by society, by humanity, by civilization, to see the world the way we see it. So we all just hypnotized to see the reality the way we see it right now. It may be slightly different or completely different. Kind of interesting. But going back to your experience in psychedelic and your experience in traditional medicine, what kind of advice you're going to give to people who are going to be specifically clinical facilitators in Colorado, people who are going to maintain their licensure as clinicians, as therapists, or clinicians, actually, they're going to have it for nurse practitioners as well, and facilitators. And this is when we start thinking spiritual and material together, toolbox getting bigger, a whole bunch of ideas. So tell me what you're thinking.
Yeah. Well, by no means do I have like the absolute metric by which to measure that response, but I can tell you my honest opinions, which I feel are informed. I think number one, I think it's very important that you intimately know what it is that these medicines can do. And so what I mean by that is that, you yourself are willing to undergo the process of growth that they can facilitate in a patient. And I do think it's important that we have like different kinds of theories and techniques in place, certainly. But I don't think that that's at any point like a totally adequate replacement for having firsthand knowledge of it. Outside of that, I think that, one should be very committed to their own growth, and one should be very committed to having an honest look at themselves. And, I'm not asking or expecting that anybody should be perfect, but that, we should always be striving to be good and healthy individuals. And ultimately, as at this point, we're all kind of like spokespeople in an emerging field, I think that we should be setting a good example for what we would want our patients to achieve. And I think it's very important, not to totally rush into this sort of thing with patients. And, I, as a facilitator too, to really take your time to learn it. I don't want to use like a traditional model as the set gold standard, but, typically people take a lot of time. And way before they're able to, be in any kind of position of facilitating, they're expected to have a certain level of emotional maturity, and overall expected to be like, well-functioning members of society. So in a traditional aspect, like a person who would have been like a shaman, that person is expected to be adept in all areas of life, which if you look at it from the perspective of like a mental health facilitator, we should know about depression. We should know about anxiety. We should know about how people navigate life transitions. We should know about how people, what happens to a person's psyche when they have their first child, and what is the process of grief. So basically, striving to be a well-rounded person and understanding that is a moving target. That's something that we're going to have to revisit within ourselves from time to time in order to really offer adequate care to somebody and to really meet them where they're at.
So there's going to be two types of licenses. One of them is just facilitator license, 150 hours of training plus 40 hours practicum. And another one, clinical facilitator, which is the same thing, plus another license on top of it. We understand the importance, as you said, that clinical facilitators who maybe never tried psilocybin in their life, but they still wanted to practice facilitation, they probably should try it. Just, even government cannot tell them, go ahead and do it. But they should try it, because otherwise, if you teach in person to drive a car, it probably makes sense for you to drive car before you start teaching. So, but the other direction as well, it's just you have a license and you have responsibilities with your license. And you also, with your license, you have other means. You don't have just psychedelic therapy in your toolbox. You have other things. And by the way, another very cool question I want to ask you. So you practice both traditional therapy and psychedelic therapy. What do you think, what part of the toolbox psychedelic therapy should take? How many percent?
Well, I honestly, I could say, rather than giving you a number, it's very much case by case. But I do think that it is an important thing to have for sure, because you will receive people that are stuck. You will receive people that have maybe exhausted other options. And you will receive people that will want to have a meaningful look at themselves. And so, judging off like the caseload that I have and the kind of clients that I've attracted so far, I'd probably say maybe about 40% are on the psychedelic end of things, and the rest, we just do more like traditional forms of therapy, and I've never even mentioned it to them. So,
got you. Well, I'm hoping that psychedelic therapy will take even bigger chunk of the toolbox at some point, but I don't know if our society is quite ready to accept it. We have too much stigma to just take it on. But what would you suggest for somebody who has mental health disorder and haven't tried? I mean, when I'm saying mental health disorder, it sounds so big. Talking anxiety, all of us have anxiety. But somebody who has anxiety, who realize that they have anxiety and want to do something about it, and want to decide which way to go. Should I just go to therapists who never heard about psychedelics? Should I go to facilitator who will just work with me with psilocybin medicine, but this person just going to hold my hand? Should I go to person who does both? Pros and cons? What do you think?
Well, I think I would look in the middle. Yeah, maybe both. But ultimately, and I have worked with people who have anxiety before, specifically with psilocybin. So what you do, or what I have done rather, is that I have helped them sort of understand, what is the source of that anxiety, and also have helped teach them tools to more effectively mitigate it when it comes up. Because ultimately that could come up in the context of a psychedelic experience as well. And, should they have better tools to work with it while they're in an expanded state, they could actually be given an opportunity to experience it in a different way than they have before, and possibly see beyond it or see past it. So I think the thing with just using a conventional psychotherapy approach is that sometimes it doesn't really give people access to experiential learning or experiential wisdom, in that they could have an intellectual or psychological understanding of, of what is going on and where they might be, what their aim might be, or what they might be hoping to achieve. But in terms of actually having a way of experiencing that, that's not always within their reach using conventional methods of psychotherapy.
Yeah, and it's just maybe sometimes you need to have this aha moment kind of telling you, yeah, this is what it's all about. I got it. Because I remember myself going through therapy, and the therapist constantly was telling me, tell yourself you are okay. I'm like, okay, you are okay, you are okay. Still don't feel anything, you are okay, nothing. And then after depression goes away, it's like, oh my God, I'm okay. I got it. That's what it means. I could pronounce it thousands of times, but it wouldn't do anything for me until I actually feel it. And I think psychedelic therapy is something until you know what it's about, it's very hard to describe, right? And I'm listening. We also had an episode here, and you guys can check it out. We had an episode at Cheshire Corners when I believe it called one of the series Tripping with Taylor, where we've been talking about Federico Fagin. Federico Fagin has a philosophy which is telling us that our life is a little bit more than just a round world, round Earth, and a world around it that we think it is. And it's kind of related to quantum mechanics, and he's a physicist and all that, a scientist. And he said that the reason he got to this philosophy because he had a moment of realization. And I still don't know what kind of moment he has. He either had a dream, or he had a psychedelic experience, or something else that made him feel this is it. So, and that it just totally makes sense when you feel things. And that's why this experiential thing so valuable in psychedelics.
Yeah. Well, when you talk about making the unconscious conscious, you have more of a direct experience of something that may have otherwise just been a very small whisper in the back of your head. And so maybe that's what happened in his case. I mean, when you take somebody who's like trying to, get through depression or anxiety, and they have like a very small whisper of what being healthy or well might look like, under the influence, that whisper becomes like a chorus or a symphony. And so their perception fills with that in a way that it wouldn't normally be able to.
So psilocybin in Colorado will be allowed recreationally, not medically, recreationally. And what it means that people wouldn't need prescription. And they can just do it because they maybe want to feel better, heal themselves, or maybe for personal growth. So how would you suggest people who never had any experience with psilocybin, would you suggest them to try it maybe slow with microdosing, get somebody who can help them to understand it first, read about it, listen about it? What people should start with in order to slowly burn that stigma and get to the level of personal growth and healing?
Yeah. Well, I mean, I think everything you said was very wise, but I think definitely being informed and starting slow and really committing each time to doing it in the way that's safe. Whether you choose to do it recreationally or you are looking to have some kind of deeper experience, to just make sure like whatever your aim is that you're getting the most out of it. And so being informed, being in a safe safe setting, all those things are gonna help out. And I think it's good to remember that because it's so new, all of us at no matter what position you're playing in this, we're doing our part right now to create a culture and to create a cosmology around it. And so obviously there's already lots of negative opinions out there. People are going to have them no matter what, but we want to do things that are going to uphold the depth and the joy that these things can provoke, but also to be sure that we're doing what we can to create an atmosphere of safe and responsible use.
Yeah, and maybe take it not safe place have a right mindset, but also maybe a little bit of ceremonial experience. Every time you just kind of put yourself, this is not an ordinary thing I'm doing every day. This is just not just cup of coffee I'm drinking daily. This is something important, and that's something I have to be ready for, and I have to process and learn from it, and then I can go to the next step.
Yeah. And I would actually say even the same thing about microdosing as well. You know, because for folks who do that, it's sort of easy to have your microdose in the morning or whatever, and not regard it with regard it as though you were just like taking a vitamin or something. But it's good to remember that you are taking a medicine, and that there are changes that it induces, even if they're subtle.
And I want to remind our viewers, please like us, please subscribe to our channel. And please find the information about Gerard all at the bottom of this video in the description. So you can, if you're in California, in Oakland, right? You should be able to connect with Gerard. And if you're not in Oakland, there's still always a telehealth. So you can connect and still learn from telehealth, all the integration and certain settings. And if you're in any state of United States for psilocybin, you might not be as lucky as we are in Colorado. You still have ketamine. And ketamine, I think you told me that you practice in ketamine therapy as well. So tell me a little bit more about that.
Yeah. Well, I'll begin by saying I was initially a little bit reluctant to it because I have a background working with plants, and because like the very first time I heard about it, it was at a party. And I didn't quite like what I saw. But I worked in inpatient psychiatry for about 6 years. So I worked in a place where people get like 5150s, and they're having a lot of very, very serious life distress. And so while I was working there, a good friend of mine, who I would shout out, her name is Melissa Whippo. She's a LCSW here in Oakland as well. She was working at a ketamine clinic and introduced me to it. And I was really taken aback by the effects of it, particularly within the context of a lot of the cases of treatment-resistant depression that I had seen while working at that psych hospital. And I realized, wow, like this is definitely like a missing link. This is definitely something that would be very, very helpful for a lot of folks. And there's many ways that it's used. In addition to like the higher level doses, there's also people who can take it to achieve somewhat of an effect similar to like an antidepressant, but without having to take it every day and without this continuation syndrome. And so, in effect, I think a good way to describe what it does is it kind of gives you a break from your own mind. And so for people who have like suicidal thoughts, treatment-resistant depression, OCD, a number of other things, a lot of times they don't really get a break from their own story. They don't really get a break from their own narrative. And again, like going back to the idea of experiential learning, experiential wisdom, for many of them, that is actually a chance for them to get like out of their story and out of their symptoms for long enough to realize that something else is possible, and to kind of, break that very self-destructive chain that they're caught on. And that alone is often sufficient for people to begin to experience some betterment of health, because rather than having like an idea of what a healthy baseline is, they actually get a chance to experience it, even if it's just for a few hours. But of course, like under the influence, your sense of time is suspended. So it's somehow feels like, like you've been there forever and like you were never not there. I mean, there's many numinous things that the higher level experiences that can provoke. But even for people that are using it at a much lower level, I've seen like personally with some of my clients that they've had like positive outcomes. They had a client who used the S-ketamine spray probably only once or twice a month for relief from his anxiety, and that's all that it really took for him.
Yeah, and the unusual thing about ketamine that ketamine Spravato was actually developed as a protocol on top of SSRIs. So you can have SSRIs, antidepressants, and ketamine. You can take ketamine as a way to getting off SSRIs. And of course, ketamine is very much faster acting than SSRIs. Instead of going through 3 treatments to figure out that nothing worked for you, you can just go and try with ketamine and then add SSRIs later. So you can play with all those medicine in order to find the right balance for you. And ketamine is available in all 50 states. And in Almadelic, here in Almadelic, we right now in Colorado, Florida, and Ohio, and someday we will be in California. So hopefully we'll be able to work together in the ketamine realm as well.
Yeah, I certainly hope so. I didn't actually know that about Spravato and antidepressants, but yeah, that is a good point. That you know, for the most part, yeah, ketamine is pretty safe to take with a lot of like modern, you know, psychiatric drugs, which is very beneficial for people wanting to do work with psychedelics, because there are like, you know, cases where like, you know, other things might be contraindicated with an antidepressant and whatnot.
Well, I appreciate that you coming here and explaining us of something that's going to be a really mainstream here, and we just living here kind of pre-revolution in anticipation. Here's few more months, and oh my God, it's going to be blooming here. I hope you can come to Colorado and see how we're going to be doing, be our guest, come to our healing center whenever we're going to open it. Maybe you can have some ceremonies here, and let's be in touch. Thank you so much for coming.
Yeah, thank you for having me.
Appreciate you.